So one of the great things about the GMMH Trust is that it gives you lots of training opportunities. There's lots of opportunities around subspecializing in psychology and training in specific clinical models which are evidence-based, and really take our career pathway in the direction that we really want to around progression and positive growth.
I've been to uni a few times, so I've topped up my nursing diploma to a degree. I've been trained as a CBT therapist and then again to specialise in psychosis and bipolar. I've taken part in secondments and research trials, so I've been really lucky actually. I've had quite a lot of opportunities in the Trust.
I think working for GMMH and particularly in the team that I'm working in, I found them so welcoming. I really felt quite fostered by them and kind of cultivated in my skills and knowledge, but also gave me that space to learn. And I feel like the Trust as a whole has allowed that as well.
We're one of the biggest research trusts in the country for mental health research, so if anybody's interested in research or joining clinical and research together, a really good place for us to come and do some work. Data from the NHS staff survey tells us that people who feel invested in their department do really well. So we're trying to do everything we can to build towards that.
Our programmes are validated by the University of Manchester, but here we are on an NHS site and all our staff are employed by the NHS. I think that really grounds us in the clinical reality. So all clinical training programmes will have an academic component. There will be assignments that you have to pass and teaching that you have to attend, but they also have a clinical component. You have to learn how to treat patients. You have to be a good therapist.
One of the things I really value is having the ability to make the right decisions. And I think a lot of that comes down to autonomy in your kind of the way you think about your work, the way you think about your caseload, the way you think about being able to offer group work or individual work. And I think being able to have some of that autonomy around that decision making allows me the space to be the clinician that I want to be.
The Psychological Therapies Training Centre is where we train cognitive behaviour therapists, and we do that both on adult programmes and on children and young people's programmes. We use service users' expertise, our experts by experience. A service user or carer who brings their experience of having been through a course of cognitive behaviour therapy to inform and improve the training of therapists.
The type of person I'd want to receive care from would be curious, mindful, empathetic. A positive experience I've had with a member of staff here would be when I was involved in the long-term health conditions project. I felt really comfortable doing the whole thing, so yeah, I was really grateful for that member of staff.
I think the best thing that I ever received was having a therapist that truly understood what my needs were, both with my physical health and my mental health and how they played against each other. I think these are things that are really needed for a therapist.
There's benefits in terms of pensions, in terms of sick pay. We have a library service, we've got our research units, we've got a training centre for psychological interventions.
I think there are some specific challenges working on an inpatient ward. It's not something I'd ever done before. Often finding it quite difficult to integrate into a service that isn't familiar with psychology, and even if they are, it's still hard to find the space or even the time to speak with staff and patients. I think it's been great to slowly integrate into these services and having that patience to do that.
That's what makes it really stand out for me, is the personal and professional growth opportunities that I've got and really being able to deliver what I feel so passionately about.